Hi there, my name is Dr. George Olstein. I'm a dentist and I work in Prahran, which is a suburb of Melbourne in Victoria. In today's video, I want to talk to you about dental trauma. That's dental trauma, or more simply, injuries that can occur to teeth. In this discussion, I want to divide it into two sections. One would be a discussion about baby teeth injuries, and the other one is injuries to permanent teeth. With baby teeth, you can either have a fracture to the actual tooth itself and a piece broken away, or the tooth can come out totally out of the socket. If it's a tooth that's broken away, I suggest you ring your dentist fairly quickly and get them to have a look at it. Now, the dentist will need to make a decision whether the tooth needs to be repaired or whether it's very close to exfoliating anyway. That means that the tooth is due to come out and the next tooth to take its place. The dentist will probably opt to taking that remnant tooth structure out at the time. If the tooth has totally come out of the socket, then it's important that you do nothing at all, and this compares to a permanent tooth where we talk about replanting the tooth. But in a baby tooth, please do not do that, as you may actually injure the developing tooth bud or the second tooth that is developing underneath. However, it's probably still best that you speak to the dentist and see him or her, just so that they can assess whether there's any soft tissue injuries and treat accordingly. So, in summary, with a baby tooth, if it's a fractured piece of tooth, see the dentist straight away. If it's come out of the socket, do nothing at all other than seeing a dentist. Let's turn our attention now to injuries to second teeth or permanent teeth. First of all, if there's a large chunk of tooth that's broken away, there's a good chance that that may be able to be rebonded, or if not, the dentist will probably repair it with either a simple composite filling material or a veneer, or maybe a crown if necessary. That will be decided by the dentist and you at the time. If the tooth needs to be stored, or the piece that's broken off needs to be stored, the best storage medium is either in a container of milk, or the patient can spit into a container and use his own saliva, and then you can keep the broken piece in that. Now, if a tooth is totally come out of the socket, it's really important that you institute some emergency treatment, because the time is of essence here, and if you can get that tooth back into the socket as soon as possible, the chances of long-term survival are greatly enhanced. Now, if the tooth has come out and you need to handle it, please only handle it by the crown part of the tooth. That's the part of the tooth you can see in the mouth. The other part is the root structure, which usually goes underneath the gum into the bone socket. Please don't handle it by the root structure, because the root structure has very important delicate cells and ligaments that help in the reattachment of that tooth into the socket. If you handle it by the root structure, you will probably damage these cells, and again, the chances of long-term survival are reduced. If you can't put the tooth back into the socket, or the person that you're trying to put it back into isn't comfortable or confident that you can do it, then you need to put it into a storage medium, and that would be either milk again, or into saliva that the patient has spat out into a container. If the tooth is dirty, you can rinse it off very quickly in running cold water, but don't spend too much time, and we don't want you to store it in water, just plain water, because again that will damage the cell structures on the root. But if you can put that tooth back into the socket after rinsing out, that is the best option. You can then place a hanky to hold the tooth in place, and then be seen by a dentist as soon as possible. I hope this video has helped you understand what to do in this sort of situation, and I look forward then to doing another video with you sometime in the future. Thank you for watching.